leukemia. So, the objective searched in the use of anti-cancer treatment is to reach tumoral cells in order to destroy them in a way as selective as possible while operating one or more targets. All these explain the multiplicity of the research undertaken in the field of cancerology. Progress of molecular biology has allowed the emergence of different therapeutic approaches which deeply do not affect the operation of healthy cells. So, immunizing defenses of the organization, cellular differentiation, angiogenesis, and the apoptosis constitute the principal explored ways. However, there are these ways are generally unbalanced by expression of proteins having a strong activity tyrosine kinase, and this led to the marketing of anti-cancer treatment non-cytotoxic imatinib with its two specialties, imatinib and ilivac. First, inhibitor of receptor tyrosine kinase, and this discovery was followed thereafter by introduction of the other molecule in the same class, dasatinib and nilotinib. Anti-cancer treatment indicate means used in the treatment of cancer which interfere with the cellular cycle either by modifying the structure of the DNA or by disturbing the proteinic synthesis. So they involve the reduction in the tumoral cells by two processes, either by antimitotic effect or by cytotoxic effect. Anti-cancer treatment include different approaches, such as chemotherapy, which is more cytotoxic, hormone therapy, immunotherapy, and targeted therapy, which is less cytotoxic. Targeted therapy indicates anti-tumor molecule able to inhibit an oncogenic way directly implied in the carcinogenic and the progression, carcinogenesis, and the progression of the tumor cells. They aim at the cellular event playing a main function in carcinogenesis and proliferation initiated by receptor tyrosine kinase of growth factor and angiogenesis. So their target can be membrane, cytoplasmic, or present in the extracellular medium. There are different kinds of targeted therapy, monoclonal antibodies, and tyrosine kinase inhibitors. So first one, monoclonal antibodies are presented by glycoprotein obtained starting from a cellular clone and recognizing specifically only one type of antigen fixed on a cell or controlling protein. Tyrosine kinase inhibitors block the activity tyrosine kinase of receptor of the cytoplasmic protein essential to the transduction of signal of proliferation. So for this one, tyrosine kinase inhibitors, we have monocyclic tyrosine kinase and multicyclic tyrosine kinase. Monocyclic tyrosine kinase inhibitors block the activity tyrosine kinase of receiver human epidermal receiver 2, like gefitinib and nilotinib. For multicyclic tyrosine kinase inhibitors, they block the activity tyrosine of many receivers, which give an anti-angiogenic, anti-proliferative, and pro-apoptotic action. We have, for example, imatinib, dasatinib, and nilotinib. So, for this treatment, which are available in Algeria and used actually in the treatment of chronic myeloid leukemia, we have three molecules, imatinib, dasatinib, and nilotinib, and they have all different chemical structure with heterocycle pyrimidine-pyridine for imatinib and nilotinib, and thiazole for dasatinib. They have all the same chemical grouping carbamate. And we have, for the new tyrosine kinase inhibitors, nilotinib and dasatinib, we have individual chemical grouping, such as chlorine in dasatinib and trifluorocarbon in nilotinib, with an electroattractor character, and which are strongly active. So these new molecules are strongly active compared to the early molecule imatinib, which is the molecule of reference. So, about the mechanism of action for tyrosine kinase inhibitors, they act by competitive inhibition with the site fixing the ATP of tyrosine kinase related to the BCL-ABL protein. So, the phosphorylation of residue tyrosine kinase is blocked, preventing thereafter the transduction of signal of proliferation, and it results from it in inhibition of the proliferation and induction of the apoptosis of the cellular lines carrying Philadelphia chromosome positive, and which prevent chronic myeloid leukemia. So, the objective of our study were principal objective to evaluate the tolerance with the inhibitors of receptor tyrosine kinase among cancer patients. Secondary objective was to determine the carcinogenic risk factor among these patients. We have carried out descriptive and retrospective study in a series of 33 cancer patients, including 70 men and 60 women, in service of hematology CHU in Algeria, during December 2012-2013. And we have started by harvest of the data, so information were collected on a monitoring sheet of patients and biological assessment, and data analysis was made by using cards of investigation, which were sized from Excel 2010. Thereafter, the data were expressed as percentage and average. We have distributed the collected data in the tables, which allow the development of different graphics and the comparison thereafter with the reviews of literature. So results. The most prevalent slice was represented by female sex with 52%. The most prevalent slice was represented by patients having 45 to 60 years with 40%, and medium age of 45 years, and to extend 17 years to 72 years. So we haven't children which are which were excluded. Professional situation, the most prevalent slice was represented by those unemployed with 55%, and followed by the workers full-time and workers partial-time with 21%. The most prevalent cancer patients were inhabitants in Annaba, which is the wilaya located in the extreme northeast of Algeria with 42%. And this was explained by the fact that these cancer patients were accessible in the service located in the same wilaya of Annaba. And this percentage was followed by cancer patients inhabitant in wilaya of Yelma with 12%, just in the south of Annaba. So, the most prevalent pathological antecedents were represented by infection, 9%, and hematologic disorders such as anemia and thrombosis with 9%. And this was related to the nature of cancer, which is chronic myeloid leukemia, what was the principal indication of the tyrosine kinase inhibitors? Carcinogenic factor, we have noted genetic factor with 12%, which were the most prevalent. For those having in their genome Philadelphia chromosome positive, and followed by the professional exposure with 3%. We have noted only one case having 50 years, which was strongly exposed during its work near to the industrial area in Skita in the extreme northeast of Algeria. He was strongly exposed during its work. All the treated cases had chronic myeloid leukemia, which accounted for 100 of the patients. And what was the principal indication for tyrosine kinase inhibitors? Imatinib, dasatinib, and nilotinib. Different therapeutic protocols were prescribed, either in first intention or in second intention after using chemotherapy, including hydroxyurea. And several molecules were used. We have imatinib with its two specialties, imatib and Glivec, dasatinib, Sprycel, and nilotinib, Tazimia. For all these therapeutic protocols, the most prevalent slice was represented by cancer patients having received tyrosine kinase inhibitors after using chemotherapy containing hydroxyurea, and we have noted a peak for imatib with 55%. Different symptomatic treatments were prescribed to correct or to prevent the noted undesirable effect. The most prevalent was antibody with 35%, and followed by coagulant, antiacid, coagulant, and antihypertensive with 11% in order to correct or prevent the undesirable effect. We have noted different frequencies in the symptomatic treatment. This was related to the differences in the nature of undesirable effect for each tyrosine kinase inhibitor. Tolerance to the tyrosine kinase inhibitors. We have distributed the different undesirable effects in three classes: specific effect for tyrosine kinase inhibitors, common effect with the previous chemotherapy used for cancer patients, and complication or cumulative undesirable effect. The most prevalent common undesirable effect were noted with imatib with 91%, and followed by Glivec, which gave 86%, so less than imatib. Glivec gave only 40% for complication compared to the imatib, which gave 39%. So we have noted here just only one case with complication. For the new tyrosine kinase inhibitors, we have noted less specific undesirable effect, less common undesirable effect than imatinib with its two specialties, imatib and Glivec, which is the molecule of reference. We have noted also for nilotinib less common undesirable effect and less specific undesirable effect than imatinib. And we have noted the disparition of complication or cumulative undesirable effect for the new tyrosine kinase inhibitors, dasatinib and nilotinib, compared to the molecule of reference, imatib or Glivec. So, about specific undesirable effect noted for each tyrosine kinase inhibitors. We have noted especially osseous pain for imatinib with 30%, followed by hypertension and myalgia with 22%, and edema in third position with 9%. Common effects were represented mainly by asthenia with 74%, followed by gastric disorders with 57%, and cutaneous disorder and central nervous system disorder with 35% in third position. Complications for imatinib were major asthenia, early stomach pains in first position, 13%, followed by major asthenia, colopathy, and thoracic pain with 9%. Glivec, which is the second specialty for imatinib, gave first position myalgia as a specific and desirable effect with 29%, and followed by tachycardia, anemia, hepatic steatosis, and edema with 40%. We have noted here disparition of osseous pains and arterial hypertension, which were noted with imatinib, which is the other specialty of the same molecule, imatinib. Common effects of imatinib, Glivec, were represented mainly by asthenia, so we have noted here less common and desirable effect than with imatinib, and especially for asthenia, followed by the other effect, cutaneous disorders, gastric disorder with 29% in the second position, and thereafter psychic disorder, anorexia, central nervous system disorder with 40%. For Glivec, we have noted only one case having received hydroxyurea or hydria as the chemotherapy in first position, first intention, then imatinib, Glivec, which developed colopathy and respiratory allergy. So that was less than the undesirable effect noted with imatinib. For dasatinib, which is a new tyrosine kinase inhibitors, we have noted tachycardia, osseous pain, and hemorrhoid with 70% as a specific and desirable effect. The common and desirable effects were represented mainly by gastric disorder with 50%, asthenia, cutaneous disorder, and anorexia. Nilotinib, which is also a new tyrosine kinase inhibitor, gave in particular anemia with 80%, which is specific for this molecule, and followed by the other effects such as ecter, hematological disorders, osseous pain, hepatic steatosis, and myalgia with 9%. For common and desirable effect for nilotinib, we have noted less common and desirable effect than for the molecule of reference imatinib, and especially with cutaneous disorders, gastric disorders, followed by anorexia and asthenia. So, in our series of 33 cases, all the treated cancer patients had chronic myeloid leukemia, which accounted for 100 of the cases. The frequency of each sex was half of the total manpower of our series. The age bracket of adult patients having 50 to 60 years was the prevalent slice with 85%, with a peak for those having an age from 45 to 60 with 40%. The majority of these adults are unemployed, which explains the prevalence of cancer patients in this population. The unemployed represented half of the total manpower with a frequency of 54%. So the stressful by the unemployed here could be regarded as a factor predisposing to the cancer, which is added to the other noted carcinogenic factors, such as the genetic factor at 4 cases and the professional exposure at 1 case. The antibody were prevalent as symptomatic treatment with a frequency of 35%. This is explained by the increase in the uric acid, which was the principal biological undesirable effect of imatinib. Then the antiacid with 30%, followed by antihypertensive coagulant in third position with 11%, in order to prevent or correct some undesirable effects such as hypertension, heartburn, and hemorrhage. And this difference in frequencies is dependent on nature and frequency of the noted undesirable effect. The study of the tolerance showed that imatinib Gleevec gave only 1 case with complication, colopathy, and respiratory allergy, with disappearance of the osseous pains and the arterial hypertension, which were obtained with imatinib. What confirms good tolerance of the specialty of Gleevec compared to the imatinib, which is more cytotoxic. We didn't note any complication for the mutyrosine kinase inhibitors dasatinib and nilotinib, with reduction in the specific effect. Dasatinib gave only 70 of osseous pain, nilotinib 9% of osseous pain and 9% of myalgia. A reduction in the common undesirable effect, especially for asthenia, with 33% for dasatinib and 9% for nilotinib. And this testifies to a better tolerance of the mutyrosine kinase inhibitors dasatinib and nilotinib compared to the molecule of reference, imatinib, with its 2 specialties, imatinib and Gleevec. So, as conclusion, we can say that according to the GOT results, we noted a specificity of the undesirable effect of each tyrosine kinase inhibitor, such as osseous pains with 30%, arterial hypertension with 22%, and edema with 9% for imatinib, and anemia with 80% for nilotinib or thalassemia. We noted the tolerance of the specialty of Gleevec compared to the imatinib, and the better tolerance of the mutyrosine kinase inhibitors dasatinib and nilotinib compared to the imatinib with its 2 specialties. And in spite of the limited manpower, the results got concerning nature and the frequency of the undesirable and toxic effect are well correlated with the reviews of literature. Through this data, we raise also the interest of selection of therapeutic protocol and the importance of the strict monitoring and the undesirable and toxic effect of targeted therapy. We underline the role of responsible authorities of health, which must encourage the production of expensive medication in order to ensure best taking in charge of cancer and to improve the dispensation of the new anti-cancer treatment, especially for the targeted therapy. Voilà, and thank you for your attention.
One question? Yes.
I was just intrigued by the high incidence of gout, apparently, and do you know how uric acid is elevated by these treatments? Because it connects to my talk, because it's a main inducer of inflammasome activity. So Seems like a very unwanted side effect, maybe.
Can you repeat your question?
Okay, I'll do it more slowly. Do you have any idea how the uric acid levels are being increased by treatment?
Well, the reviews of literature show that there are differences about the treatment cancer in each population. So in Algeria, it's not the same that in here, for example. So data are different about treatment cancer and about each class of anti-cancer treatment. If we talk about targeted therapy, it's not the same as the chemotherapy, and it is also different between countries. So well, I haven't give any data for anti-cancer treatment, but it is always submitted and actualized.
But the appearance of gout, specifically, how does that happen?
La question c'est la goutte.
La goutte.
La question c'est une implication
it is related. Voilà, it is related to the undesirable effect which was given with imatinib. It gives as biological undesirable effect increase of uric acid. So this increase is always corrected by using antibiotic treatment.
But how do you get uric acid? Do you know, does it interfere with xanthine oxidase, or do you have any idea on the pathways?
Pathways. How we get it?
How we get uric acid?
It is an undesirable effect which must be corrected.
I know. But from the mechanism of how you
We
get
have
it.
explained here just the clinical undesirable effect. We haven't already explained and treated the biological undesirable effect. It's also vast
It's
and
known.